my name is Dylis-Judith Mensah. I'm a dietetic intern with the Track 2 program at Illinois State University. Today I'm going to be conducting a nutrition-focused physical exams, and I have my lovely Shannon Douglas, who is a diet tech here at OSF, and behind the camera is Bonnie Williams as well, who is an RDN. So let's begin. So to begin, I just want to give a little background on malnutrition. It can be defined as an acute, subacute, and a chronic state of nutrition in which a combination of varying degrees of undernutrition with or without inflammatory activity have led to a change in body composition and diminished function. Nutrition assessment is the stage of the nutrition care process where an RDN collects evidence on things such as food intake, biochemical data, and basically anthropometric data. And then NFPE is a great way to also collect information about a patient. Usually there are 4 techniques that you can use for an NFPE, which include inspection, palpation, percussion, and auscultation. With inspection, you're using more of your senses where you're observing things such as color, shape, size, and texture. And with palpation, it's more like a touching kind of exams where you use your fingers to feel for pulsations, vibrations, and assess the body for its structures. For percussion is a technique which will be used to identify gastric air bubble or intestinal air to identify the presence of fluid in, for example, like lungs. With auscultation, you want to listen to sound produced by different parts of the body, and you typically will want to use your naked ear or maybe a stethoscope. So for this NFPE, I will be particularly using just 2 techniques, inspection and palpation. So for this physical exams, what I'm going to be focusing on is macronutrients. The 3 macronutrients, as we know, are carbohydrates, protein, and fat. To assess, I'll be focusing primarily on fat loss and muscle loss. Protein is important for building and maintaining muscle mass. We also see a manifestation of protein deficiencies in the features of the hair and nails, as well as indications of non-healing wounds. For subcutaneous fat, it's usually the fat underneath the skin, and one way the body stores energy is through subcutaneous fat. So our carbohydrates and our fats are usually going to be evident in this part of the body. It is the padding to protect muscles and bones from the impact of hits and falls. So in an inpatient setting, before I see a patient, I would have to review their medical records for anthropometric data and data on relevant labs, medication, as well as getting a good understanding of their past medical history and what the patient is in the hospital for. We will assume that for this patient here, I've already done all that. So let's begin. Typically, before I start a nutrition-focused physical exam, or even before I enter a patient's room, I observe personal hygiene protocols as well as PPE protocols as pertains to the hospital's policy. When I enter the room, I go, "Hi, Shannon. How are you today?"
Okay.
My name is Dylis. I'm a dietetic intern here at OSF, and I'm here to conduct a nutrition physical exams on you, as well as ask you questions with regards to your nutrition. As part of the nutrition focused physical exams, I'm going to be touching your arms, your neck, and some parts of your body. Would that be okay?
That's okay.
Is there any tender places I should be aware of?
Okay.
At this point, I would ask questions with regards to the patient's appetite, the patient's weight over the course of time prior to admission, and even in inpatient, like in a hospital, I'll ask questions with regards to any nutrition or energy intake as appropriate. So we would assume that I've done all that with this patient. We're going to try to do the protein part first, like the basics of her hair, ask her about wound, and also just check her nails first, just so that we can clear that out of the way before we do the muscle and the fat loss. So, have you noticed any hair fallout for some time?
No.
Okay. Do you have any wounds?
No.
And then have you noticed any features of your nails like breaking and all that?
No.
Okay. So that's good. We are going to go straight into the muscle and fat loss now. So please, I'm going to be touching your temples. I'm going to feel for your muscle there to check for the strength and the tone of it as well. So you're going to do this with a scooping motion. Before you start, you want the patient to clench. Could you clench 2 or 3 times for me? Thank you. You are checking for signs of hollowing or evidence of depression around that area. Next, I'm going to be checking underneath your cheekbone and above your jawline. I'm going to be palpating and checking to see if there are any hollowing or any sunken depressions. So we are going to assume that here. I'm sorry if my hands are cooked. Okay. Next place I'm going to be checking is her clavicle region. So in an inpatient setting, usually we will take off the gown. I will ask the patient for permission to move the gown just so that we can have a visual inspection of the patient's bone before we touch them. So I'm going to assume that I've done all of that. And you want to put your hands, you want to feel for muscle by checking the part above the clavicle bone and checking underneath to see if your hands fit under in any way. And that helps you to know the prominence of the muscles there as well. Next, I'm going to be checking your shoulders. Usually you want to hold the person's shoulder and then palpate the person's shoulder to see the prominence of the muscles in there. And with the acromion process, we usually will also check around to see if there are any signs, any visible bones on the acromion process or any depressions as well. Next, I'm going to be looking at her back. And usually for the back muscles, we need to engage them. So typically you want your patient to push against something. So could you please hold and push against me? Okay. So straighten your arm. Okay. So this way you usually will check for any muscle, the prominence of the muscle or any depressions in the back by palpating the back to see that. Thank you. The next thing we're going to be doing is checking for fat loss in her triceps. Here you want the patient to have her arm at a 90-degree angle. You're going to hold the bottom of her triceps and then you're going to move your hand just to separate the fat from the muscle and see the thickness there. Also in inpatient setting, if the patient is comfortable, you're going to be checking for fats loss around the rib cage area and the mid-axillary line. Typically, you want to locate the ending of the iliac crest, and then the beginning of the hip bone, and you want to pinch just to feel for any fat loss around that area. Another great way to check for fat loss is to also observe the ribs for their prominence or how they look on the patient. A very malnourished patient would have very, very visible ribs, which show an indication of fat loss around that area. Next, we're going to be looking at her hand for muscle loss. We are going to be looking at the interosseous muscle, and I want the patient to do an OK sign. Yes, with the OK sign, we're going to be checking for signs of hollowing and depression at this end of the person's palm. And that is an indication of muscle loss if it is really sunken and you can visibly see like the bones in that region. Another way of also checking for muscle loss in the palm is to tell the patient to have to cup their hands as if they're throwing a ball and show, yes, like this, yes. And then typically this we are looking for the tenor muscles where we hold, you can just palpate the inner parts of the palm to just feel for the prominence of the muscle there. Usually with a patient who has lost muscle in their palm, you realize that it's a bit sunken and not as firm as in a well-nourished patient. Thank you. Next, you're going to be moving to the lower extremities. And with the lower extremities, we are going to be really focusing on muscle loss. We are going to be checking for the thigh, inner parts of the thigh, and we're also going to be observing the knee as well as the calf. So to do this, you want the patient to bend their knee just to engage the muscles there. Okay, good. So here we are just going to be observing. Typically, we have the clothes off, and you really want to have a touch, a skin to skin kind of approach with all these examinations to help you to have a good visual understanding of what is happening, as well as also help you with your feel, how prominent the bones are or how depressed the muscles are. So usually we just palpate using your index finger and your middle finger. You can engage other fingers as well, just to have a good feel of it. And I'm just checking for her quadricep muscles here in her inner thigh, and then on her knee, I'm focusing more on her patella, the patella muscles. A squaring of the knee is an indication of muscle loss. So also in the rounding of the knee is an indication of a well-nourished person. You do not want squaring in the knee. Okay, so for the muscles in her legs, I'm going to be asking her to straighten her toe, yes, just to engage her muscles in here. And then I'm just going to be palpating here as well, just to feel for the prominence of her calf muscles. Sometimes in athletes, you realize that because they use their legs a lot, they have very, very prominent muscles. They are firm, so that's just one thing to note. Thank you very much. Okay, so this is the end of our nutrition-focused physical exams. Thank you.